Today, we're diving into a really fascinating study from the Journal of Nuclear Medicine. It's about a new imaging technique that could literally give doctors a new pair of eyes to see not just that cancer is there, but exactly how to fight it. So, let's just set the stage here. We have to start with the reality of ovarian cancer. It's an incredibly tough disease. The 5-year survival rate is less than 50%, and a huge reason for that is it's usually caught so late in the game. But, there has been this huge beacon of hope in recent years, a class of drugs called PARP inhibitors. For a lot of patients, especially those with certain genetic markers, these drugs have been a complete game changer. They work by basically stopping a cancer cell from being able to repair itself. But here's the catch, and it's a big one. These drugs are not a silver bullet. They work amazingly well for some people, but for others, not so much. Our current methods for figuring out who gets them mostly rely on genetic testing for things like BRCA mutations. And that's good, but it's not perfect. So that brings us to the big question. How do we know, before we even start, who's actually going to benefit? Okay, so to try and solve this puzzle, researchers came up with a brand new tool. Think of it like a molecular detective, a PET scan tracer that's designed to hunt for the drug's exact target right inside the body. It's called F-18-FTT, or Fluorthanatrace. Now, a standard PET scan, that just looks for general cancer activity. This thing is way more specific. It's engineered to find and light up the very enzyme that PARP inhibitors are built to block, PARP1. So it's giving us a direct look at the target itself. For the rest of this, we'll just call it the FFT scan to keep it simple.
Here's a really simple way to think about the difference. A standard PET scan, that's like looking at a factory's huge energy bill. You know something is going on in there, it's really active, but you don't know exactly what. This new FTT scan is way more precise. It's like going inside the factory and checking to see if the one specific machine you're trying to shut down is actually there and if it's even turned on.
And that leads us to the million-dollar question that these researchers really wanted to answer. Does this new, super specific scan actually give us different and maybe more useful information than the standard scan we've been using all this time? So, they put it to the test. They ran a clinical trial where they did both types of scans on 14 women with ovarian cancer, looking at 55 different tumors in total. And honestly, the results were not what anyone saw coming. So finding number one, the two scans basically had nothing to do with each other. There was zero correlation. A tumor could be glowing bright on one scan and be totally dark on the other. It was like they were telling two completely different stories about the exact same tumors. Second, they looked at the tumor grade, which is basically a measure of how aggressive the cancer is. Now, you'd think the most aggressive, high-grade tumors would have the most of this drug target, right? Well, nope. The study found no real difference. Some of the low-grade tumors were actually the ones that lit up the most on the FTT scan. But this was probably the biggest shocker of all. Even the gold standard, the BRCA gene mutation, was not a good predictor of FTD uptake. What they found was that some tumors with the BRCA mutation had really low levels of the PARP1 target, and some tumors without the mutation had sky-high levels. All right, let's just stop for a second and pull this all together. What this is telling us is pretty profound. The FTT scan is giving us totally unique information, stuff that isn't predicted by anything else we use, not by standard scans, not by how aggressive the tumor is, and not even by the patient's genes. And this all points to one really powerful idea. This FTT PET scan could be a totally new kind of biomarker to help guide treatment. So, what does this all actually mean for the future of treating ovarian cancer? Let's take a look at the bigger picture. Now look, any good study is going to be honest about its limitations. The big strength here is that it was a prospective study, a head-to-head comparison of the two scans. The main weakness, and this is pretty common for early research, is the small sample size, just 14 patients. So this is incredibly promising, but it's still an early step. But let's think about what this could mean for patients in the real world. The potential here is just massive. Imagine if you could select patients not just based on a BRCA mutation, but on any patient whose tumor has a high PARP1 signal. You could open up this treatment to a whole new group of people. And maybe just as important, you could spare women from the side effects of a drug that was never going to work for them anyway. Of course, this is just the beginning. The next obvious step is to do this again with much larger trials to confirm everything.
But the real prize, the ultimate goal, is to prove that a bright FTT scan at the beginning directly predicts that a patient's tumor will actually shrink when they get a PARP inhibitor. Now, a skeptic would be right to look at this and say, hang on a second, 14 patients? That's interesting, but we're a long, long way from changing how we actually treat people. Genetic testing is still the proven standard. And you know what? That's a totally fair point. And the authors would probably agree 100%. The point here isn't to throw out genetic testing. It's about adding another powerful layer of information. Think about it like this. Your genes can tell you that a tumor has a vulnerability, a potential weak spot. The FTT PET scan goes a step further and actually confirms that the target for the drug is right there and in high numbers. And that really brings us to the core takeaway of this entire study. This FTPT scan gives us a window into the unique biology of a tumor that we just could not see before. It's giving us information that is completely distinct from our standard scans, from the tumor's grade, and even from its genetic code. And that leaves us with one final kind of mind-blowing thought. What if this is an early peek into the future of true precision medicine? A future where a scan doesn't just show us where a tumor is, but shows us the perfect weapon to destroy it. A future where treatment isn't based on statistics or probability, but on actually seeing the target with our own eyes.